Good evening, everyone. Welcome to Pediatrics by Dr. Anand. Is my voice audible to everyone? Please put a message in the comment section. Good evening, amazing people. How are you all? Good evening, Dr. Osama, Shubhanki, Shubham. Yes, Devyanshi. A beautiful evening today. How are you doing? Is my voice audible to everyone? Please let me know in the comment section. Yes, okay. Hello, Orion, Osama, Mansi. Yes, Priya Gupta. Yes, Shekhar. Very good. Aditi. How are you? What's up? How's everyone doing today? आवाज आ रही है या नहीं आ रही है? कौन बताएगा? Is my beautiful voice coming? Is this $1 million voice coming to everyone? Yes or no? There are a lot of students who want to join this beautiful class in our app also. I hope you guys are a part of our beautiful app. Amazing app, Pediatrics by Dr. Anand. And life is just beautiful. Thank you so much for all the love and support. And I'm just sharing the beautiful link CNS batch we have in our app. I hope you guys are amazingly participating for that. Okay. Yes, I'm just messaging. Come on, YouTube. Yes, okay. Chalo, can I start? Okay, beautiful people today. Amazing. Anji, chalo ji. I can see everyone. Is the face visible, audible? Okay, great. Hello Manish. Hello Faizan, Raza, Shubhangi. Okay, चलो जल्दी शुरू करते हैं. शुरू करो अंताक्षरी लेके प्रभु का नाम करने के लिए, कुछ करने के लिए, है ना? कुछ करने के लिए बोलो राम राम राम. मेरे पे आया, मैं शुरू करता हूँ. Good evening, everyone. Welcome to Pediatrics by Dr. Anand. Today is the CNS class, CNS part 3. And amazingly, everyone was beautifully waiting for this CNS amazing class. Let's share some good amount of knowledge and just feel happy that we are still living and surviving so beautifully. My name is Dr. Anand. I've done my MBBS from Rajiv Gandhi University Health Sciences. Also did my MD in pediatrics, and most importantly, then I did my SRship from Lady Hardinge Medical College. There is a beautiful college, hospital, Dr. NC Joshi. I did my SRship from there. Then I did my SRship again from Hindu Rao Medical College. Then I did my AP-ship. Ayyo, I have studied a little bit. So, and also we have some amazing teaching experience who teaches the UGPG, DCH, MD, and DM students. On this beautiful coverage of pediatric classes, CNS is the topic of choice, and I hope you are beautifully will share some good light on this beautiful topic. Before starting any amazing segment, we always have a motivating quote. Did you see that curtains going and leaving like this? Looks classy. The beautiful quote for today is, when I hear somebody sighing, when I hear somebody saying life is hard, it's a beautiful quote. When I hear somebody saying life is hard, I'm always tempted to ask, compared to what? Compared to what? When I hear somebody saying life is hard, I'm always tempted to ask, compared to what? Today we have parents. There are people who doesn't have a brother, doesn't have a father or mother. Are we comparing from them? If I have a if I have a car, then there are people who have a scooter, and if I have a BMW, there are people who just have a XUV. So with whom are we comparing, bro? Are you comparing with someone bigger than you, smaller than you? With whom are you comparing? So should we compare? Yes or no? Do you really think you need to compare yourself with anyone else? When I hear somebody saying life is really hard, life is really hard, life is really hard, so I'm always tempted to ask, compared to what? What compared to what? So what is the moral of the story? The moral of the story is, tell yourself you are a perfect soul. Moral of the story number 2, tell yourself you are an amazing soul. Tell yourself you are kind, you are humble, you are beautiful. They always say that love and respect can do wonders. So always be happy. Life is really beautiful. Just good vibes. I mean, do something what your heart says. Don't hurt anyone's feelings. Don't poke into other people's stories. You have your own. Enjoy, live. If someone has to stay, they will stay in your life. And if someone has to leave, then they were never meant to stay. No, you stay with me, I will be very sad. Stop all that. Be happy with what you have. Be happy with who you are. And the time you accept who you are, you might appreciate who you are. So are you understanding? Yes or no? Let's start this beautiful class, my dear friends. In the last class, we spoke about NCC. Today, we have to finish that beautiful topic of neurocystic sarcosis, and we have to start the neural tube defects. These two are very excruciatingly important topics with amazing image-based questions and video-based questions. Can we please start the class? Yes, yes, beautiful. Dr. Manish, good evening, brother. Good evening, amazing people. Can we quickly revise and start off with this beautiful segment? If this is the NEET PG question for today, what should I write in exam? Should I leave this question or should I attempt this question? I think we must attempt this question, sir. This looks like a MRI brain, which beautifully stays. What can you answer in the comment section, please? Yes, Dr. Osama, say, shake. Starry sky appearance. Starry sky appearance, very important. In the night when we are sleeping and looking at the stars, so this beautiful picture is like, imagine you're looking at the stars, and starry sky appearance. 2 days back, when I was going out in the night, I saw the sky. I was like, you, starry sky appearance, is this a NCC? So you need to link and study. It will be beautiful. In the previous class, we spoke about some amazing stuff regarding something. I don't know what is this. Dr. Osama, could you share some beautiful light? This is my own hospital patient basically having this picture. Can you please tell me this CT showing what, or MC? Hi, this is CT1. This is showing what? Can you please tell me who is this? Who is this cutie pie in the picture? Who are they? Who are they? Are your friends? Yes, this is Chintu. This is Mintu. So can you please tell me what is the other name of Chintu and other name of Mintu? So Chintu and Mintu is nothing but the head of the tapeworm. This looks like, bro, Scolex. This is a Scolex. Okay, this is the tapeworm, head of the Scolex, head of the tapeworm, known as Scolex. Let's start this beautiful class. In this, yes, in the last class, I will just have a random revision for these 5 slides, because in the last class we beautifully spoke about it. Shubhangi told some amazing points. Most importantly, this is the neck. First of all, who is she or he? Is it Osama or Shubhangi? Can you name this creature? It's a beautiful, pretty, happy, amazing, blood-sucking creature. So this is the amazing neck of this beautiful person. And what are these? In the last class, we spoke about it. Can we please quickly revise? Suman, Priya, Manish, Faizan, Rajkumar, Grace, export in 5. Yes, nothing but Ashutosh. अभी तो मुझे नाम याद है. Manish. Yes, so I think beautifully spoke about neurocystic sarcosis. We spoke about the what you called point number 1, neurocystic sarcosis. I think we spoke in the previous class. What is the best answer? It is a parasitic infection. It is a parasitic infection that we spoke about it. And also this only that photo which I showed you was the Tinea solium. Yes, exactly. Yes, Swati, Norset also can join. Anyone can join on this beautiful planet. So this beautiful creature, this is the neck. I'll repeat again. This one, like this is the neck. Then what are the suckers? So that's important, bro. These are the 3. Basically we have the suckers, the center is the rostellum, and then that is the hook. It can be a very basic image based question. Identify the personality. Is it Shah Rukh Khan or John Ibrahim? The answer will be, it is Tinea solium. Tinea. Can we say hip hip hooray for Tinea? Tinea. Okay, so Tinea solium. It's not Shah Rukh or this one, but my favorite is Aishwarya. I like Aishwarya very much. Okay, okay. Yes. Dr. Shiv, I was waiting for your this one, bro. Message me. I'll send you the prize. That day I forgot only. There's someone who messaged me also. I have to send you, bro. Right now, WhatsApp me. I will send you the prize money. Dr. Shiv, I have to send him 100 rupees Paytm for the last amazing CNS class which he participated. Who is the definitive host? In the previous class we spoke about, is this a man like Osama, monkey like Shubham, chimpanzee like Amrit, and deer like Shubhangi? So I think the beautiful answer for this question will be that neurocystic sarcosis, the definite host is man. It is a parasitic infection. You see a starry sky appearance on the MRI. Amazingly, in the last class we spoke that if you eat uncooked pork or uncooked beef, then only you'll get this infection. Yes, very well put. So in the basic, Shubham bhi aaya hai. Shubham, kya haal hai? Shubham, hi Shubham, what's up, bro? All good? What was the gym exercise? You share me your evening gym routine. I need to cross check. Are you working out or you're just fooling around? Yeah. What is the mainstay of diagnosis for neurocystic sarcosis? Anyone can answer in the comment section. It's a very beautiful, positive, good vibes class. Yes, Shiv, brother, I got your WhatsApp. Bas to 9:30. You see, at 9:31, I will send you the prize money. Okay, bro? Exactly. Karan says, thank God मैं नहीं था. तो tension ना ले, तेरे को भी आके मैं डालता हूँ कहीं बंदर और chimpanzee में. The mainstay of diagnosis for this condition, I think if we talk as doctors, if we both talk, then I think CT and MRI, CT or MRI. Nelson and Piyush Gupta says that CT or MRI MRI kara lo, it will be fine, because usually mainstay, the patient of neurocystic sarcosis, the symptoms are very non-specific. Like in our hospital, frankly, what I have seen, the recent patient, a 7-year-old boy came with unexplained seizures. A 7-year-old boy came with unexplained seizures. Like a 11-year-old boy came with unexplained seizures. And we always talk about that. Did the baby cried immediately after birth? Was there some hypoxic insult? Because hypoxic insult can lead to seizure. Was the patient having prolonged fasting? Because hypoglycemia can lead to seizures. Was the patient having diarrhea? So high diarrhea can lead to seizures. Are you understanding? Are you understanding what English language I'm talking about? Yes or no? Please let me know. Dr. Shubham. Good. So when everything is normal, frankly speaking, so the mainstay of diagnosis is usually CT or MRI, because the symptoms are like non-specific. I do not have a very beautiful past history, because past history, the child was perfectly fine. Mother says, Doctor Saab, the child was perfectly fine, playing, running, doing this and that, and suddenly he got a seizure. So that was a seizure. So unexplained seizure. So you should go to CT and MRI. That's important. And who is Scolex? Yes, can you please tell me who is Scolex? What is the other name of Scolex? The other name of Scolex is Karan. Okay, Karan, तेरे को बना दिया मैंने Scolex. Okay, joke करने कर दे. So just as a joke. So who is Scolex? It's important, bro. In the MBBS final year question, if we put a CT or MRI showing beautiful, appreciating picture of this one tapeworm. So head of the tapeworm, bro. I'll show you this picture, dear. 1 second. Let me just show you. 1 second, bro. 1 second. 1 second. Yeah, so this one, if you are a final year MBBS student and examiner is like, very expecting a lot from you, then definitely he can ask this very beautiful, pretty question. What is this? Who are they? So this is Scolex. What is Scolex? Sir, first you act, okay, 5 seconds. Sir, Scolex, okay, okay. Then you say, sir, it is the head of the tapeworm. Very good. So after gym to Baba, another level of excitement. Has everyone understanding, yes or no? Am I making sense, or should I speak Spanish or German, or should I use Sanskrit? Exactly. Yeah. Good. Very good. Very good. Yes. Yes, Karan. Okay. 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 Garmi. Okay. Has everyone understood this much? I hope you guys are beautifully understanding. Yes, great. Okay, yeah, yeah, beautiful. Yes, yes, my dear. I'm gonna, clear your doubt. So the hallmark of NCC is a starry sky appearance. This was a starry sky appearance. Yes, the beautiful point is it's a lesion with a ring or disc enhancement. Like this was a neat question recently. A patient who had an unexplained seizure, it was a question. The MRI of a 7-year-old who had an unexplained seizure showed a lesion with a ring or even a enhancement. So lesion, so that's what we saw in the MRI. No, it's like a lesion with a ring. Are you understanding, my dear? It's a lesion with a ring that's we showed in the CT or MRI. I showed you that picture. So this could be a proper theoretical question in the MCQs for FMG and NEET PG, that a 7-year-old boy with unexplained seizure, the MRI showed a lesion with a ring or a disc enhancement. That's what. So lesion with a ring or disc enhancement with an eccentric scolex appearing as a bright central dot, like a bright central dot and a beautiful ring enhancement, like a with a ring. Are you understanding, my dear? Like that's a beautiful point. Yes, Dr. Medicine concepts made simple. I will clear your doubt in the further slides. Yes, can just wait little. Okay. Yeah. So again, another beautiful way of representing this starry sky appearance. So all this that's why, dear, I'm showing you a lot of pictures, bro, so that you can get a very beautiful idea that how different the picture can come. This also is a very beautiful starry sky appearance. This also is the arrow beautifully showing these all are beautiful scolex, all are the starry skies, all are the amazing starry skies appearance. Okay, this is our real patient only, and once I zoom the picture, as I've already told, this one that's a photographic memory plays a very important role. You are amazing, you are beautiful, and you are a rock star. मैंने बस ऐसे ऐड कर दिया line. Yes. Now one important thing. Yes, exactly. Starry sky in Burkitt's starry sky appearance in MRI is seen in neurocystic sarcosis. Great. Okay. हाँ जी, आगे बढ़ें. Can we move further in life? Cute. Let's move. Can you please now one thing I want you guys to remember, that the lesion or this ring enhancement and all that, This could be a tuberculoma also. I'll repeat again that there is one important differential diagnosis, like one very important point I want to tell you. If you're expecting neurocystic sarcosis, if you are expecting neurocystic sarcosis, do you know what is the mainstay of treatment for neurocystic sarcosis? Now, this is something I want to tell you very importantly, bro. If you expect to diagnose some ring enhancing lesion, which you thought that, sir, it could be, kind of a neurocystic sarcosis or a scolix, you must rule out tuberculoma. You must rule out tuberculoma. That's very important, because NCC lesion and the tuberculoma lesion, they look alike. They look same. I'll repeat again. This is something very important I want to share, because if you are suspecting neurocystic sarcosis in any patient, you always should rule out TB in that child. Why? Can anyone beautifully answer in the comment section why I must rule out tuberculosis if I'm suspecting neurocystic sarcosis? Because, my dear, neurocystic sarcosis, you give steroids. Very, very important, bro. You give steroids plus you give albendazole. If you're a final year MBBS student, if randomly on a table viva question, examiner show you this question, this NCC, and ask you what is the treatment, so steroids and prednisolone we start, and albendazole we give. Okay. So one very beautiful point I would like to appreciate here: in your future, if you become amazing doctors, and if you're planning to, if you saw some ring enhancing lesion with a very beautiful central dot, if you are suspecting neurocystic sarcosis, you must rule out TB, my dear, because number one, you are starting steroids in this patient as treatment for NCC, and if by mistake the patient is not having NCC, if having some TB or tuberculoma, then you know, right, if steroids you give to a tuberculosis patient, what will happen? It will flare up the infection. It will flare up the infection. That's very important. That is why you must rule out tuberculosis in a child if you are planning to start the treatment for neurocystic sarcosis. In our hospital also, frankly speaking, once if you are suspecting NCC, we do the TB workout, we do the ophthalmology workout, we do all these scans also, because it can cause complications everywhere. So we need to rule out all the other areas which are working fine, and then plan to start the steroids and albendazole. Now, one very beautiful important thing: what is this, guys? If I say this doesn't look like a NCC, if I am like a hi-fi doctor and saying this looks like a tuberculoma, what do you think, guys? Why do I say this looks like a tuberculoma? Yes, Dr. Karan, you're right. Osama, my dear, right? You're right. Shubhangi, Grace, Hennabot, Shiv, yes, Mansi, Panola. Sone sone patole lakha. After reading her Patola, I remember. So that's one beautiful point we must appreciate, that every ring enhancing lesion is not neurocystic sarcosis scolix. It could be tuberculoma. Now this is a very beautiful question examiner can ask you: how do you differentiate neurocystic sarcosis from tuberculoma? Can you randomly tell me that what you called which one is more severe, or which one is more which one is more severe? Is NCC ring enhancing lesion is more severe, or tuberculoma ring enhances is more severe? Dr. Karan says, sir, मेरा doubt CSF analysis करके. Bro, Karan, yeah, it all depends, bro. Actually, frankly, if I tell you, I tell you one thing. Like, one patient had come to our hospital only 1 week back, that an 8-year-old child with unexplained seizure. Someone having 8-year-old child with unexplained seizures, bro, and if the child is perfectly fine, like Dr. Saab, he got one episode of seizure in casualty. We gave anti-epileptic, and next day the patient is running, he's fine. He doesn't have meningeal signs, doesn't have some encephalitis or altered sensorium. Then Dr. Karan, then dear, this one, what you called CSF is not that mandatory. If the patient show you signs of meningitis, which is nothing but neck rigidity, Kernig's sign, Brudzinski sign, or the patient show you the signs of raised intracranial tension, like a focal deficit, like a irritability, like a photophobia, lethargy, irritable, and kind of stuff like that. So in that case, my dear, if you're suspecting meningoencephalitis or meningitis, that time to pakka you should do a CSF analysis. Otherwise, if a patient has one episode of seizure which was fine by anti-epileptic, and next day the patient is running and okay, type is fine only, no other focal deficit I should rule, I could able to find, then CSF is not that mandatory. Has everyone Understood this much? Yes or yes, yes. Please let me know. Please let me know. हम्म। तो कौन समझ में आ रहा है? फैजान, सुमन, राज, करण, is everyone beautiful understanding? Can we move further? Yes or no? धीरे धीरे बोल कोई सुनना ले कोई सुनना ले. Yes, the first question, bro, that neurocystic sarcosis and tuberculoma, can you please tell me, like, if you're a doctor, if you're an amazing doctor, let's play doctor. Can we play doctor, please? Or the Faisal, Faisal Reyes. Yeah. So what do you think, Daksa? What do you think? Which one is more big in size? Is it neurocystic sarcosis or tuberculoma? So bottom line, remember, usually if you talk about size and sight, usually brother, that tuberculoma is like more severe. Like one कहते हैं ना 100 बात की एक बात. इतना गर्मी लग रही है actually, AC on नहीं कर रखा किसी ने. I'm feeling a little hot. Yeah. Okay, first deep breaths. I get very excited when I teach. I should, I should control my heart rate. Tuberculoma, the size, it is bigger in size, more than 20 mm. As far as the beautiful site is concerned, NCC is supratentorial, and amazingly, tuberculoma is infratentorial. Can you please tell me in the comment section what is supratentorial and what is infratentorial? I have no idea. If this is the brain, cerebrum, and this is the cerebellum, can you please tell me? I have no idea, bro. Can you tell me what is like roughly? Can you tell me, bro, what is what do you called supratentorial and infratentorial? Thank you, Dr. Suman. That's very kind of you. Yeah. So, bro, this part, bro, okay, please remember, dear, this one. This is the demarcation point. The cerebrum is the supratentorial part. The cerebellum, dear, is the infratentorial part. Will you remember this for me? Yes. Cerebrum is supratentorial and cerebellum is infratentorial. Remember, okay? So tuberculoma is more severe, more bigger in size, more than 20 mm. It is usually infratentorial. And as far as the perilesional edema is concerned, I just now told you, bro, that in a case of NCC, it will be mild, but in a case of tuberculoma, it will be moderate to severe. Will you remember this for me? It's important, okay? And also, as far as the midline shift is concerned, as I told you, that naturally tuberculoma, like just remember one thing, bro, that tuberculoma has little bigger stuff, like more things are there bad. So midline shift is more common in tuberculoma. The size is more than 20 mm. The site is infratentorial. Just imagine, can we have a beautiful photographic memory? Tell yourself you have amazing photographic memory. Tell yourself you are amazing. Okay, so can you remember in your beautiful brains that there's a brain and there is some big one more than 20 mm tuberculoma, which is in the cerebellum, infratentorial, which is very severe, which has little more of the midline shift. And most importantly, as far as cyst wall is concerned, this is important, bro. Again, this is important, my dear. The cyst ka wall is thick. Can we please what you called see that beautiful picture? One second. Yeah, this one, bro. The cyst wall, brother. Can you see that, my dear friends, my dear brothers and sisters? Can you see that, my dear? Yes, exactly. That the cyst wall is thick. You'll remember, okay, in a case of tuberculoma, the cyst wall is very thick. Okay, and one very beautiful thing, scolex. Will you see scolex? Where do you see neurocystic sarcosis in tuberculoma? It is absent. Yes, exactly. Okay. Manish says, Sir, coffee pillow. Cute. I don't drink tea. I don't drink coffee. I like milk. Milk. So can you please tell me which is your favorite brand? Like, do you like Bonvita? Do you like Horlicks? Or you're a Complan boy? You're a Complan boy. Can you please answer in the comment section? Bonvita spelling. I don't know much of Bonvita. Don't mind. Yes, which I recommend everyone. That's like one crazy stuff. In all the classes, I always recommend something like I always I just want you to be amazing. Your parents should be literally proud of you. Your parents should be so proud of you, bro. Like, I frankly speaking, like, your parents should be really proud of you. You should be beautiful. Please don't be destructive in life. Be constructive, be amazing, be beautiful, be better, be just amazing. People should get inspired from you. They should not run away from you. It should be inspired from you. Like, wow, yeah, that's amazing. Good vibes. So, which is your favorite brand? Can you answer in the comment section? Okay, Dr. Suraj says Boost. Boost hai jahan, Shakti hai wahan. Okay, cute, nice. Anyone? Okay, Suman says, Sir, I only have carrot, banana, and smoothie. Smoothie. I like yogurt. Shrikhand kise pasand hai? Who likes yogurt? I like yogurt. The strawberry one is really good. Hanji, Dr. Shiv says Amul toned milk. Are you toned? You're a proper gym fellow, I think. My sister takes toned milk. It's so bland. Toned milk is like pani. Toned milk is like water. I have taken toned, I have taken double toned, I have taken skimmed milk also. I have taken. It's water. I like bhais ka doodh. Do you like bhais ka doodh? Okay, English. Okay, Shubham always corrects me. Please speak in English. There are people who does not understand what is bhais. Buffalo, dirty fellow, dirty yellow. I like buffalo milk. I like cow milk. I like full cream. And my gym instructor has told that you should eat everything because I'm a rock star. So beautiful. Okay. Suraj, yogurt is love. Yeah, I love yogurt. Faizan, strawberry. Strawberry, it's nice. My favorite is strawberry. Yeah, Shrikhand बहुत मीठा होता है. Karan, even breast milk is also very sweet. Remember guys, remember everyone, breast milk is very sweet. माँ का दूध बहुत मीठा होता है. क्यों मीठा होता है? Can you please tell me why breast milk is very sweet? Because the predominant carbohydrate present in the breast milk is lactose. It's a neat PG question. शुभम कहाँ पे? शुभम है तू यहाँ पे? Yes, yeah. So yeah, the neat PG question number 1, which is the predominant carbohydrate present in the breast milk? The predominant carbohydrate present in the breast milk is lactose. That is why माँ का दूध बहुत मीठा होता है. Breast milk is very sweet. If you guys have tasted, oh, current extra point, lactose. We have PhD holders over here. 1 point I say, then there are people saying 10 points. Grace says, do you know speak Kannada? Nanage Kannada gottu, nimage gottu. Yeah, I have taken Kannada classes for 6 months in Bangalore. I've done my MBBS from Bangalore, my dear. So I know Kannada. Yeah, ನನಗೆ Kannada ಗೊತ್ತು. Now, very important. Can you please answer in the comment section? Raised ICT features will be in which case you'll see more, brother. You'll see in NCC or you'll see in tuberculoma, like photophobia, like a focal deficit, like irritability, like too much of light. Oh, I am getting very irritated, mama. Like that. Our children, they say that, not our children and the patients in the ward. So I think as beautifully told that obviously raised ICT is very common in a case of tuberculoma. And if you are a beautiful, amazing MBBS student, if the neurocystic sarcosis is a very commonly asked question, and like nowadays we're asking very crazy question to our MBBS student. We never asked a theoretical question just like a NCC for 5 marks. I will be making a MCQ. A 8-year-old boy, when he was playing with his friends, then he got a seizure which was generalized tonic-clonic. There was no history of previous episodes. They came to hospital, they got a MRI done. Then MRI showed some ring enhancement lesion with the central dot and perilesional edema, which looks like a colic. So how do you approach this child? What do you think? And why and how should you rule out this from tuberculoma? Like this, I will be making the question. Okay, then out of 10, 9 students will say question paper is very tough. Pata nahi who has made the question very tough paper. So bro, remember this, okay? Because my HODs always tells me to make such elaborative, detailed, long, lengthy questions so that we all can beautifully understand. So it's the whole concept is to share the knowledge, share the experience. You can buy anything. You can buy a BMW Grand Limousine, carbon black color, which is only of 65 L, and but you can't buy experience. That's the important part. Focal deficit is very common in a case of tuberculoma that we know. Now treatment, yes. मराठी नहीं आती. Dr. Shiv, I'm really sorry. I have only one friend who is Marathi, and only two things I know. Me तुझ्यावर प्रेम करतो, and then we say me पण. Me पण means me too. That's all I know. History say yes, Dr. Saab, history. As far as pediatricians are concerned, history plays a very important role. Before touching the child itself, just by history, you should know what is the diagnosis. Treatment, guys, can you please answer in the comment section? Please, treatment. So treatment actually based on investigation and management. And investigation is concerned, we have already spoken about it. Rule out everything. Hypoglycemia, get the R in. If I like always remember, bro, everyone, hello, everyone, my dear. Okay, first deep breath. I get very excited while teaching. I should literally control my heart rate. And Osama. Hmm. So, as far as the investigation is concerned, in a case of someone came with seizures, as for hypoglycemia, I should take the patient's random blood sugar. I should take the patient's calcium to rule out hypocalcemia, sodium, potassium, all the electrolytes should be ruled out. Obviously, if the patient has some meningoencephalitis feature, then of course CSF analysis sounds a very amazing answer. Then later you should go for CT or MRI. Please remember, hello everyone, listen to me, everyone. You have to be amazing doctors. An amazing doctor does not mean that you send all the investigations. Are you understanding? My HOD always used to say, bro, common things are common and rare things are rare. And until listen to me, Khan Miki Mail Saaf karke, please remove your earwax and listen to me because the brother is saying something amazing. Whenever someone asks you a question for anything, like first of all, how do you manage this case? If this is a very basic question for all of you guys who gonna after the MBBS, once you apply for internship in a medical college or JRship in the medical college. If someone asks you, how do you manage this case, any case, neonatal seizure, NCC, hypoglycemia, anything. So it's always say the treatment is divided into investigations and management. Are you understanding? Hello, Osama. कान में रुई डाल दिया या सुनाई दे रहा है? Yes, exactly. Yeah. So treatment is divided into investigation and management like that. You should first speak. And if someone asks you, patient came with seizure, and if you're suspecting NCC or a patient came with seizure, how do you manage? Please don't open your yellow teeth wala mouth saying CT MRI. CT MRI will do. So don't first say CT MRI. It's an expensive procedure. India is a developing country. People do not have money for 1,000 rupees CT and 7 to 10,000 of MRI. It's a very expensive procedure. Maybe you never know that many of our patients, they land up into hypocalcemia. We thought of NCC, just you correct the calcium, the patient is fine. Are you understanding? Hello, Bate chatting was very cute, but are you understanding, bro? Everyone, what did we learn today? We learned that all the investigations are not important. Number one. Number two, you go hierarchy wise. Common things are common. If someone asks you NCC or seizure, how do you manage? Don't directly open your mouth CT and MRI. No, don't say that. The examiner will be like, very good, CT, MRI. Such a beautiful student. Dr. Shubham is very good, very good. Come after 6 months, okay? Very, no, that's very proud of you. Come after 6 months. And then Shubham will run and say, Mera bahut acha paper hua. My paper was fantastic. Are you understanding? First tell me, did we understand this much? Yes or yes, yes. Let me know. Karan says yellow teeth wala. So you have white teeth. Dr. Shubham says, Sarji, I saw your advertisement when it is coming. Yes, I got an ad from Colgate. So yes, Colgate है जहाँ तंदुरुस्ती है वहाँ. वो तो लाइफ बॉय का ad है. But I got an ad from Colgate. It's amazing. Thank you so much for all the love and support. These guys, they approached me on Instagram and they said, we want your 2 to 3 minutes video. It's a 2 minutes quick video where I'm gonna bite a carrot, where I'm gonna bite a what you call waffle, and I'm gonna say that क्या आप देख सकते हैं that to bite a carrot you need so much of energy, so that for that you need good teeth. The Colgate ad. So you guys, do you guys brush every day? Please let me know in the comment section. There are so many comments, bro. ओसामा मैं कैसे पढ़ूंगा इतने सारे? ओसामा, okay. शुभांगी सर, शुभांगी ने आज laughing gas सूंघ ली. Okay. Suman says, I saw when come to learn other language that three words were the first preference. Yes, yes, that's true. Okay, Osama says, मैं तुमसे प्यार करता हूँ, इसका मतलब हुआ ना सर? Yes, me तुझावर प्रेम करतो is nothing but I love you, and me पण means मैं भी. Okay, yeah, language सीखना parrot नहीं है Manish. Okay, cute. Can we move further? Thank you. Yeah, so controlled seizure sounds a very beautiful answer, and one very basic stuff, remember bro, steroid and albendazole is the treatment of choice. And examiner will ask you, okay, Dr. Shubhangi, steroid and albendazole. Okay, madam, Dr. Shubhangi, if you get only one option, like to start, will you start albendazole first and will you start steroid first, and why? Can anyone beautifully answer in the comment section, please? Dr. Shubhangi, mera pyara bhai Osama, Amarnath Yadav, Karan, Shubham. Yeah. So there are these people are amazing, you know. Osama is in touch with me from last 6 to 8 months, and Shubham be chumbak ki tarah, like a chumbak. They all Shubhangi also. So beautiful. And Shubhangi is very sweet. Someone's birthday is there, no, Shubhangi will message me, sir, Shubham's birthday is there. I just wanted to remind you. Can you please wish him? I was like, bro, I have already wished him. And it's funny. Yeah. So the best answer for this question is brother first. Remember? Yeah. That's the thing. First you start the steroid, then you start the albendazole. Why? Because if you start the albendazole first, the scolex will die. Once the scolex will die, he can lead to more edema around when he die, and the patient can have seizures. The patient can have through a seizure. So once if you give albendazole and the tapeworm will die, then it can have a edema in the brain leading to seizure. So let me give something anti-inflammatory, and then let me start the albendazole. We give prednisolone at the rate of 1 to 2 mg per kg per day. We give that. And after 3 to 5 days, OP guy says day 3 onwards. In our hospital also 3 to 5 days, 3 days onwards, after giving a prednisolone, we start the beautiful albendazole. 15 to 20 mg per kg per day. We give for 1 week. Many books says many things. Nelson says 21 days. In our hospital also, frankly, we follow 21 days. And OP guy says what he called for 7 days. But Nelson says 21 days. So we follow Nelson. And Piyush Gupta also. 21 days is a good quantity, and the durations 15 to 20 mg per kg per day, that you should know. And oh, that finishes this topic. Has everyone understood, yes or no? Yes, that finishes this topic. Let's have a very beautiful, quick, amazing, mind-blowing, happy revision. Yes. Okay, so let's start this again. Very quick revision of this one. In this beautiful class, we understood what? When I hear somebody saying life is hard, I am always tempted to ask, compared to what? You need to just be happy, okay? Don't like, just be happy. Then also we understood that MRI picture like this looks like a starry sky appearance. Then also we understood something about the head of the tapeworm, which has various parts. Neurocystic sarcosis is a parasitic infection where basically, this looks like a head of the tapeworm. It could be a very basic image-based question. The definitive host is Osama, that is a man. And uncooked pork or uncooked beef you will eat, you will have issues. Uncooked pork, if you eat, you will get a tinea solium. If you eat uncooked beef, you'll have tinea saginata. And one very beautiful thing which I want to share, that even pure vegetarians also can have NCC. I have seen so many cases that we got a big scolex. Chicken, do you eat chicken? Do you eat pork? Doctor साहब, we are pure vegetarians. ये तो onion भी नहीं खाता. He does not eat onion also, doctor साहब. We are pure vegetarians. I was like, where did the scolex came from? Then fecal-oral, the child might be running into grass and all that, and from there he can have these problems by the kind of क्या बोलते हैं इसको, grass. Dr. Mozum Ahmed says, sir, be my guest at Qatar one day. I went to Dubai, Qatar. I'll come. We'll take a class there. Collect students, let's have a class in Qatar. And anyway, I'm going to abroad after 2 months. We have 2 batches in abroad also for FMG people. The mainstay of diagnosis, we understood it's like CT or MRI. Scolex is nothing but the head of the tapeworm. Then also the hallmark, as we all know, this is important. It's an exam question. This is like, it's written in OPGI. The hallmark for NCC, starry sky, like that. That's, you need to know that point. Okay. Then starry sky, we spoke about it. Then what else? Yeah, this part is done. Then also very beautifully we understood that NCC must be ruled out. NCC should be ruled out with tuberculoma. And one very beautiful point: if you as a beautiful doctor are suspecting NCC in your child, your patient, then you must do a complete TB checkup, Montauk's sputum for AFB and CBNAT. Okay, and also at the same time, क्या बोलते हैं उसको, that eye scan also, 2D scan, DEXA scan, that also you should do, and B scan is known as B scan. Yeah. Then as far as the beautiful points are concerned, that's the usually tuberculoma is of bigger size, infratentorial with severe edema with more midline shift. Then also the cyst wall is a little thick actually. So scolex obviously is absent in tuberculoma, and raised IHD obviously it is more common in tuberculoma. Then focal deficit is common there. Then also the treatment we understood is investigation and management. Before you opening your happy yellow teeth wala mouth saying CT MRI, Before that, you should say CBC, TABCD, calcium, sodium, potassium. If patient has altered sensorium, rule out CSF analysis, and then open your mouth and say that the usually the features of NCC is non-specific. So CT MRI also is important. Steroid is first and albendazole. Steroid is prednisone 1 to 2 mg per kg per day. And then day 3 you start albendazole 15 to 20 mg per kg per day for 1 week according to OP Ghai, and 21 days according to Nelson. Comes in exams, write 21 days because we give for 21 days. Has everyone happily understood this much? Yes or yes, yes. Yeah, Danka. Oh, du bist. Do, but Karan, I have taken German classes also. After this MBBS, I had a dream to go abroad. Every guy after MBBS has a dream to go abroad. Foreign jana hai, foreign jana hai. I foreign jana hai. I don't want to go abroad. I took so many consult. Oh, there are so Pitampura NSP and Rajouri Garden. CP also in Delhi has a lot of overseas consultancies. Then if you guys want to go abroad, like you must talk to the overseas, this is right, overseas consultant on Just Dial. You will get a lot of numbers, and they have actually, you know, doctors whom they send abroad. But for an MBBS student going abroad, you can take PLAB, you can take MRCP-CH, that's nice. MRCP you can take because MRCP-CH is child health. After MBBS, you should work 3 years in the PEDS department. Then you can apply for MRCP-CH. CH is child health. MRCP is like a MBBS wala level wala exam. And what else? Yeah, so I had taken German classes also. I have done A1 and A2. I have taken the classes. It is a Goethe Institute in this Max Muller Bhavan in CP. They have very high fees, but it's good, and they have a test also. And so that certificate is very authentic when it comes to this one. Okay, Hanji. Okay. Power bank. Okay. So has everyone understood this much? Please let me know in the comment section. Yes or yes, yes. Okay. Can we move further? डॉक्टर अनन्या एसी ऑन करते हैं, मुझे बहुत गर्मी लग रही है. ओके मुझे यहीं बसना है. आई लव माई इंडिया. ओके अनन्या ये ऑन तो कर दिया बेटा, उसको बटन दबाओ. बंद है एसी. योर माय नीज नीड टू बी. क्या ऑन हो गया? प्लीज गेट आउट. थैंक यू. Okay, so has everyone understood this much? Can we move further? Yes or no? Okay. Yes, Dr. Shubham, you're right. It's A1 and A2 and B1 and B2. बहुत लंबा छोटा procedure. This is like a huge procedure. So yes, okay, okay. Dr. Faizan says, ना जाना परदेस लाडो. Cute. I got it. Okay, Danka, thank you. Okay, next topic. Yeah. So next topic. Okay, okay. Let's have a next topic. 1 second. Before starting the next topic, we always have a motivating quote, and this quote says, if you can stay positive, if you can stay positive, if you can stay positive. Is my video stuck? Yes or no? Is my voice coming? Yes or no? Please let me know. Is my voice coming? Yes or yes, yes. I hope it is coming. Am I audible and visible to everyone? I feel there is some stuck issues. Please let me know. Yes or yes, yes. Is my voice coming or not coming? Yes or yes, yes. तभी आगे बढ़ेंगे जीवन में. Okay, I think it's coming. Great. Perfect. If you can stay positive in a negative situation, you win. जिंदगी भगवान की एक बहुत महंगी गिफ्ट है. Life is really precious. Life is amazing. It's so beautiful. And yeah, someone says yes sir, clear, amazing voice. Yes. If you can stay positive in a negative situation, you win. Hello, this quote is important. Forget about the topic of neural tube defect. This quote is important, bro. I want you guys to be amazing, okay? You should have peace of mind. Just tell yourself you have the best peace of mind. Make your daily routine amazing. Once you get up in the morning, you should be excited to work, excited to go hospital, excited to do OPD. Even though if you're an intern who's gonna put cannulas, 100 cannulas tomorrow, you should be excited. Wow, I'm gonna put cannula. I'll learn something amazing. That's what you need to be positive. Hello, can we be positive? Yes or no? Who is positive? Please raise your hands. Ma'am, I'm super positive. So if you can stay positive in a negative situation, you win. You win. And that's the key, bro. That's the key. Frank, hello everyone. Positive you can be, but in negative situation you be positive. Please be positive. Don't give other people the energy to affect you. Are you understanding? Someone abusing you or saying something to you or commenting on you, if that person is important to you, then you talk to him that, my dear, why are you saying that? I didn't like it, I'm sorry, I didn't like it. But if that person is not that important, कहते हैं ना, किसी को कुछ बताना जरूरी है और किसी से कुछ छुपाना जरूरी है. So everyone's thing is, everyone's answer is not required, everyone's opinion is not required. Whose opinion is required? Dr. Anand's opinion is required. Someone close to my heart, that person's opinion is required. So remember that. Next topic, please. The beautiful topic on this planet is neural tube defect. There is a defect in my neural tube. There is a defect in my neural tube. Now this is important, okay? What is a neural tube? What is a defect? So neural tube. What is a neural tube? Neural tube is a hollow structure. It's like a beautiful hollow structure from which the brain and the spinal cord is formed. Neural tube, imagine, tell your beautiful brains, neural tube is like a hollow structure from this brain and the spinal cord. Spinal cord is a form, okay? If there is a defect in the neural tube, the defect can be at the cranial part, the defect can be at the caudal part. What is cranial? The head wala part. If you go down, bro, that is caudal. Caudal. Did you understand? Yes or no? Yes, exactly. Okay. If the defect is at the cranial part, you can have some head issues like neural tube defect, which are involving the head. For example, anencephaly. I'm going to show you every single picture beautifully. 5 more minutes we will study. It's already 50 minutes we have spoken and no one is leaving the stage. I don't know why you guys are still stuck. Okay, caudal. If you talk about the caudal part, caudal, there are some beautiful neural tube defects. Can you please tell some beautiful, amazing, mind-blowing neural tube defect which affects the caudal, matlab niche, matlab the lumbar sacral pala part? Can I say spina bifida? Can I say spina bifida? That's a very pretty caudal neural tube defect. Okay, cute. Karan, very good. Mansi, very good. Osama, Suman, and my dear Shubhangi Kaushik. So, in simple, beautiful words, can I say incomplete closure of the neural tube results in neural tube defect? Like the development of the neural tube is a anatomy embryology topic. That's not pediatric topic. If you still feel, I'll take a class on that. It's very easy. So in the anatomy they have explained how the neural tube is formed. I remember endoderm, ectoderm, mesoderm, and all this and that we used to cram nicely. So that's what. So incomplete closure of the neural tube results into a beautiful defect known as neural tube defect. Okay, 3 more minutes we'll study, then we'll chit chat. Which is the which is the most common congenital anomaly of CNS? Can you beautifully answer in the comment? हाँ जी, Dr. Shubham, और बेटा गलत, you try to give a wrong answer. Dr. Shubham, I know your house, you live in Vikaspuri. I will share your address also if you want. You give right answer. Very good. Okay. Yeah, Dr. Mansi Panola, Sone Patola. Yes, that's right, my dear. You are right. Which is the most common congenital anomaly of the CNS? The beautiful answer is neural tube defect. Which is the most okay, the beautiful question, integrated approach, my favorite. Which is the most common congenital anomaly of the esophagus? Can you answer in the comment section? Which is the most common congenital anomaly of the nose? Can we beautifully answer in the comment section? This $2 million points. This is exam question, bro. Osama Sheikh, mera pyara bhai, very good, bro. Very good. Yes, that's true. The most common congenital anomaly of the esophagus is nothing but esophageal atresia. Atresia is abnormal narrowing, and in that esophageal atresia, 80 to 90% we get tracheoesophageal fistula. That is one point. The most common, क्या बोलते हैं उसको, congenital anomaly of the nose, that is choanal atresia. Guanal atresia. Today only I was taking the class. I was asking this question. Okay, I was asking this question to the MBBS in the table viva today. MBBS final year batch A. That what is this? Sir, NG tube. Then this one, what do you called? क्या कहते हैं? Then I asked the student, if you're not able to put NG tube, it is getting stuck. What will you think? That beautiful student, she said that, sir, if it is coiled, if the NG tube is not, I'm not able to pass the NG tube. If it is coiled, then I must rule out tracheoesophageal fistula. And if it is not coiled, just not able to pass the NG tube, I must rule out guanal atresia. Guanal atresia. Okay. Yes. Yes, Dr. Karan is beautifully right. If you talk about tracheoesophageal fistula, the mnemonic is a CAT. The most commonest tracheoesophageal, the most commonest type of TEF is type C. The second most commonest is type A, and the third most commonest is type D. Dr. Osama, in the type, Shubhangi बताइए, Shubhangi थोड़ा आगे आओ, इधर आओ, Shubhangi, come here. In the type C tracheoesophageal fistula, do you see gasless abdomen or do you see a gaseous abdomen? Can you please answer in the comment section? Anyone? Actually, there should be a ₹100 prize money wala answer question actually, but chalo. Hanji, who will answer? In the type C, do you see a gaseous abdomen or will you see gasless abdomen? Anyone? Monica Kumari, Manish Yadav, Faizan Raza, Seher Fatima, nice name. CAD Karan, हाँ जी, आंसर बेटा, डैडी ने सवाल पूछा, आंसर कौन करेगा? गैसलेस, ब्यूटीफुल, अमेजिंग, ब्यूटीफुल आंसर बाय डॉक्टर शुभम. Okay, Shubhangi also gasless. Okay, so that says that I must, what you call, open that my page of respiratory system, and we have to see that tracheoesophageal fistula. 1 second, hanji, TEF. Let's see if I have slides here. Okay, TEF. 1 second, bro. Okay, tracheo किसी musculoskeletal में होगा ना TEF. 1 second. We need to talk about it because we have to link and study, bro. If you link and study, dear, you will always remember. This question is important, my dear. Tracheoesophageal, tracheo. Okay, हाँ जी, yes, we got it. हाँ जी, आगे आ जाओ. किसने बोला था, जरा मुझे नाम बताओ. 1 second, 1 second. Okay, 1 second. Life is beautiful. 1 second. Okay, ta. So as you know, as you all beautifully know, that tracheoesophageal fistula, the name of the classification is gross classification. These are the beautiful types of tracheoesophageal fistula: type A, type B, type C, type D, and type E. So doctor, I have to स्वर्ण अक्षर में नाम लिखेंगे. In the beautiful bold letters we speak, we'll introduce the amazing people who is Dr. Shubhangi. The red color is not highlighting. Wait 1 second, let me write in black. And Dr. Shubham, who beautifully said that you see a gasless abdomen in a case of type C TEF. Please 50 कोड़े शुभांगी को और 70 कोड़े शुभम को मारे जाएं. That's a wrong answer. Come after 6 months. Give me your diary. I'll write in your notebook. Bring your father tomorrow. What? Not studying? Shubhangi, you're not studying? Not studying? Beta, kahan ho aajkal? Why are you not studying? Tell me the answer. So, bro, please remember, bro, hello, when there is a connection, my dear, when there is a connection of my windpipe with my esophagus, then this is my cute stomach, bro. This is the stomach, please remember. And I must see a gas abdomen, a gaseous abdomen. Sheetal says type A is gasless. Did I ask you type A? Did I ask you? Type C, you tell me. So type C. Yes. So did you understand, Dr. Shubham and Dr. Shubhangi? Please bring your father tomorrow. I need to talk. We need to talk tomorrow. I will block you from my app. Hello, not studying. Okay. Yes. Osama says, इतिहास की डायरी में स्वर्ण अक्षर में नाम लिखा जाएगा. Thank you, Dr. Osama, for this beautiful push. So, can we please understand, my dear? That's what, bro. Can you see that? Hello, please, bro, my dear friend Shubhangi, Shubham, please write on your forehead that type C, my dear. Can we read this point? Proximal esophageal atresia. Can we see that? This one, bro, this one, hello, this one. Proximal esophageal atresia with this distal tracheoesophageal fistula. Can we say distal trachea windpipe esophageal fistula? Fistula is a connection. Fistula is a beautiful connection. So if my from my windpipe, I must have, bro, I will have a gas in the abdomen. It's a very common type C, TEF. Will you remember this? Shubham and Shubhangi, come here. But very proudly they said, no gas, no gas in the abdomen. हैं? इधर है, इधर है शुभम, शुभम कहाँ है तू बेटा? जवाब दे दे ध्यान से। शुभांगी कहाँ, क्या कर रही हो तुम? शुभांगी, व्हाट इज दिस? वेरी बैड. That finishes this class. Thank you so much everyone for this beautiful participation. Where is the beautiful topic? So we'll stop it here. In the tomorrow amazing beautiful class, we need to talk about what we're going to talk about. We're going to talk about that what are the what you call inheritance of NTD. Then also in this beautiful class, the various risk factors we're going to talk about. We're going to talk about some amazing beautiful videos where we're going to share some immense amount of knowledge that what is spina bifida occulta and what is spina bifida cystica. Before leaving, we always have some beautiful amazing $1,000,000 quote. So $1,000,000 quote today will be in Hindi. I got this random quote just now. We had it previously. Can we please have a quick look on this one? दिल का साफ होना बहुत ज़रूरी है. दिल का साफ होना ज़रूरी है क्योंकि कोई वादे करके भी साथ नहीं देता है तो कोई बिना वादे के भी जिंदगी भर साथ निभाता है. वेरी ब्यूटीफुल कोट, वेरी नाइस कोट. दिल का साफ होना ज़रूरी है क्योंकि कोई वादे करके भी साथ नहीं देता है तो कोई बिना वादे के भी जिंदगी भर साथ निभा जाता है. So that's a very beautiful point. And what is the moral of the story? What did we learn? Hello, come here, Shubhangi. What did we learn from this? What did we learn from this? Hello, Shubham. Yeah. So the beautiful point we learned from this situation is nothing but that don't promise. Don't promise. I read a quote. Promises are made to broken. Promises are made to be broken. Once you made a promise, it will break. No, I am a good girl. I always promise and make sure it is there. That's good. That's good. It is promise you do. I'm happy about it. But let's be more wise and more mature, you know. वो कहते हैं, this very beautiful quote, right? Action is louder than words. Shubhangi, Shubham, Osama, action should be louder than the words. So when I promise someone, I tell that person that I will not promise you. I'll be there. And if I'll like, you know, you'll get to know. If I'm not there, like I am, you know, there's something wrong with both of us. Maybe the friendship is not strong. But I know I'll be there. You will see. Let the time tell the whole story. Let me not, you know, promise you. So I don't take promises. I don't give promises. I just go with the flow. If you will, well, if we have to stick together, we will stick together. Shubhangi is in touch with me. Osama is in touch with me. Shubham, he keeps watching my status and, sir, nice gym, sir, nice t-shirt, sir, how much weight did you put? The tram full, he is messaging. And if I'm free, I reply. And sometimes I don't reply Shubhangi. Even in 10 days, I reply her once. So it all depends. So if there is an understanding, things are beautiful. So, you know, there's no, you know, you are so selfish, you are not replying me. Don't do all that. Thank you so much, everyone. That's amazing. Yes, Shubhangi, thank you. Faizan Raza, वादों पर यकीन नहीं करना, वादे बने ही हैं. क्या लिखा है आगे? वादा खिलाफी के लिए. अयो, what is this hi-fi word, bro? One second, Faizan. That's nice. That reminds me of Zindagi Gulzar. It's a beautiful serial you must watch. वादों पर यकीन नहीं करना, वादे बने ही हैं, वादे खिलाफी के लिए. That's beautiful, amazing. I had a good time talking to you. I hope you had a good time. Dr. Devendra Verma says, nice, amazing class. Bye, sir. Waiting to meet you soon. Thank you, sir. That's very kind of you. And I'm nothing without your support. Thank you. Thank you so much, everyone, for this beautiful participation. I hope you had a great time. I had a comfortable time talking to you. And my mom is calling now. We must have dinner. Please respect your parents. Papa mummy की टांगे दबाओ, खुश रहो, बहुत ज़्यादा दोस्त मत बनाओ, लिमिटेड रखो. Life should be, you know, life should be like a temple, you know, your heart, your mind should be like a temple. Less people, vastu, even it's proven in vastu, if you're making a new house, it should be very less furniture, very less people, very less furniture also, because too much of furniture, it's like make things cumbersome. So less furniture, be empty, open winds, should be ventilation should be good. So that's how your brain and life should be. I don't have any friends. I have just very one or two friends, closest friends I have, and which I'm happy, and that's it. That's more than enough. That's how you should be. Okay. The more people you invite, the more complex your life becomes. Thank you so much, everyone. Please take care. Bye bye. Tomorrow evening, 8:30 p.m. on our app, on our amazing app. We have, one second. Yes, we have this beautiful class tomorrow. NTD is the topic of choice. If you're free, please come. If you're not free, no problem. I can understand you're busy. You have to study a lot. Take care and bye bye.